Hey, it's Professor Gould. In this section, we're going to learn about the bones that make up the pelvis. Now, two of these we've already known about, the sacrum and the coccyx. We talked about those when we did the axial skeleton. Now we're going to talk about these bones, which you probably have heard referred to as the hip bones. Those are called the os coxae. And together, all of these make up the pelvis. Now, I do want to distinguish between the pelvis and the pelvic girdle. The pelvis is the os coxae, the sacrum, the coccyx, and this band of fibrocartilage here called the pubic symphysis. The pelvic girdle is just the two os coxae bones. This is what they look like by themselves. So if we took the sacrum, the coccyx, and the pubic symphysis away, then we're left with these two bones that make the pelvic girdle. That's what attaches the legs to the trunk of the body. So as you might imagine, that big indentation there, that's where the head of the femur articulates. So remember, the pectoral girdle attaches the humerus to the trunk of the body. The pelvic girdle attaches the femur to the trunk of the body. So each os coxae bone is made up of three sections, and these started out as three separate bones that fused during fetal development. This top part is called the ilium. Notice I-L-I-U-M, okay, different spelling than the section of the small intestine. The front part is called the pubis, and the back part is called the ischium. Now, if you could hold this bone in your hand, you would be able to see very distinctly that this part is kind of pointy, and this part has a big sort of tubercle, oval, lumpy spot. The lumpy spot is the part you sit on. The pointy part goes in the front because you don't want to sit on the pointy part, okay? The ilium itself is made from an ala. Ala means wing, so that's this big part here, and then the body of the bone here. Now, on this diagram, they've drawn these lines where the three bones come together, and if you're thinking those seem awfully straight for bone sutures, those are imaginary lines. We don't see the bone sutures on the coxal bones. So just know that this general part is the ilium, this general part is the pubis, and this general part is the ischium. The hip joint here is called the acetabulum or acetabulum. That is where the head of the femur articulates, and it does have an articular cartilage. Well, I'm having a really hard time today. It has an articular cartilage here, and a ligament called the acetabular labrum that holds the femur in. The top part of this bone is called the iliac crest, and it does make a little crest, sort of a little overhang on the lateral side. Remember, the femur is going to attach to the lateral side. So look for the acetabulum, that's the lateral side. The iliac crest also kind of overhangs on the lateral side. And it goes from this corner in the front to this corner in the back. The front corner is called the anterior superior iliac spine. And I know it's not much of a spine. It looks more like an angle, but it is called a spine. And remember, we don't use adjectives in anatomy unless we have to. So if there's an anterior something, there's a posterior. If there's a superior something, there's an inferior. And if there's both, then there's a whole bunch of these. This is sometimes called the ASIS. On the test, you will refer to it as the anterior superior iliac spine. You will not call it the ASIS. You must write out the whole name. This makes the hip bone that's visible on thin people, okay? That's the anterior superior iliac spine. See, I almost said it. All right, that makes the front of the iliac crest. The back of the iliac crest is the posterior superior iliac spine, sometimes called the pieces. And the pieces makes a little dimple at the base of the spine because a lot of muscles attach on either side of it. So those little dimples right there are where the pieces are. And if you're thinking, why are there dimples if it's a spine? It's because the muscles around it extend out farther than it does. All right, the big hole in the os coxal bone is the obturator foramen. An obturator may be kind of hard to remember, but you can just remember, hello, obturator. This cracks me up every time. All right, and then as suggested, we have an anterior inferior iliac spine. So the way to find it is go across the iliac crest. You find the anterior superior iliac spine. There's a small indentation, and the next little angle is the anterior inferior iliac spine. Same thing on the back of the bone. The top of the crest, the angle is the posterior superior iliac spine. There's a little indentation, and the next angle is the posterior inferior iliac spine. Okay, so anterior superior, anterior inferior, posterior superior, posterior inferior. Now there is the posterior inferior iliac spine is right above this big notch that is called the greater sciatic notch. The sciatic nerve travels through that greater sciatic notch on its way down the back of the leg. The lesser sciatic notch is here, and it's not on your study guide, so don't worry about it. The ischial tuberosity is this big lumpy part here. It is a very rough, sort of oval-shaped, pretty large tuberosity. People sometimes call that the sits bone. So if you sit up real tall, and sometimes people say sit up real tall on your sits bones, they're referring to your ischial tuberosities. If you're sitting on a really hard surface and it feels like your bones are digging into the chair, it's your ischial tuberosity. All right, other major markings. This indentation on this side is the iliac fossa. Remember that a fossa is an indentation. Now, on tests, I sometimes ask, what's this indentation here? And people say ilium. It's the iliac fossa. This part of the bone is the ilium, but the indentation is the iliac fossa. Okay, now notice also we're looking at the medial side. You can tell it's the medial side because there's no acetabulum here, okay? There is, however, this weird surface here, which is the auricular surface. Again, sort of ear-shaped. I don't know, doesn't look like an ear to me, but whatever. That articulates with the auricular surface of the sacrum. So the posterior superior iliac spine is here. The posterior inferior iliac spine is here. The greater sciatic notch is here. And this whole surface of this bone is not visible when this is part of the pelvis, when it's articulated with the sacrum, because this whole thing is going to articulate with the sacrum. Okay? All right. On the front, we have a little flat, rough spot called the symphysial surface, which is where the pubic symphysis goes. So the symphysial surfaces of the two os coxae go together with the pubic symphysis between it, and that's a pad of fibrocartilage. Okay, so how do you tell the difference between a male pelvis and a female pelvis? Now, there are some general guidelines, but before we get too into that, I do want to say these are general guidelines, and this is definitely not definitive, despite what crime shows would have us believe. There are many women, many female humans who have very narrow ilia, males who have wider ilia. So some of these things are more distinctive on some people, some are less distinctive on some people. Generally speaking, the pelvic inlet is smaller on the male. The pelvic outlet, this imaginary line down here, is also smaller on the male. The coccyx on the male comes forward. The coccyx on the female goes straight down. The ilia are faced more medially, whereas on the female, they are faced more forward. And then the two things that those are all pretty subtle. And if you haven't looked at a lot of pelvises, it's pretty hard if you just look at one pelvis to determine male or female from those things. Easier to distinguish is the subpubic angle. This angle here between the two pubic symphyses, or excuse me, the two pubic surfaces. this subpubic angle is narrow on a male and very wide on the female. And then, hang on, I'll come back to that. The greater sciatic notch tends to be narrower on the male os coxa and wider on the female. Okay, so and even here, like, it's kind of hard to tell this is narrower and more vertical and wider and more flared. It doesn't really seem like it from here. So the greater sciatic notch and the subpubic angle are the two things that are easier to distinguish. Also, the obturator on a male pelvis tends to be more oval, whereas it's kind of triangular on the female pelvis. Again, given a couple of, if you're looking at one pelvis, look at several different characteristics before determining whether it's male or female. Okay, so this is an X-ray showing the pelvis. Here's the sacroiliac joint between the sacrum and the ilium. Here's the sacrum here. You can kind of see the coccyx down here. There's the pelvic inlet. And you can see this subpubic angle is really, really wide. So that suggests female. You can see the head of the femur articulating here into the acetabulum, the rounded ischial tuberosity, and there is a pubic tubercle here. Okay, don't confuse the pubic tubercle with the pubic, symphysial surface. I keep wanting to say pubic surface. Symphysial surface. So there's the symphysial surface and then the pelvic tubercle. Okay, pubic tubercle. Okay, so that is the pelvis and the os coxal bones. And up next, we will learn the markings of the femur.